tingling at the tip of your finger, a heaviness in your left arm, the feeling that something is wrong, but you can't explain what. Those three signs together have a very specific clinical meaning, and it has everything to do with the heart. A heart attack rarely comes without warning. The problem is that the warnings don't look cardiac. They look like fatigue. They look like gas. They look like anxiety. And by the end of this video, I'll show you which of these signs is the most critical, the one that decides whether you still have time to act. My name is Thomas Ellsworth. And cardiovascular health has been the central focus of my work for many years. If you're not following this channel yet, do it now. What I bring here can make a real difference in your life. Heart disease is the leading cause of death in the United States. That's not news, but what most people don't know is that the majority of heart attacks don't come as a surprise. The body sends signals, sometimes days in advance. The problem lies in how we interpret those signals, or rather, how we don't. Have you ever heard of the golden hour concept? It's the window of time between the onset of symptoms and medical care that determines how much of the heart muscle can be saved. Arriving at the hospital within that window can be the difference between a near complete recovery and permanent heart damage. And to get there in time, you need to recognize the signs before they become a declared emergencies. So let's begin. 7 signs from the least obvious to the most urgent. The 7th sign is sudden cold sweat. And pay close attention here because there's a clear difference between the sweat from heat and this one. This sweat is sticky. It appears at rest, and when you're not doing anything, sitting on the couch, lying in bed, it leaves the skin pale, sometimes cold. The body is releasing adrenaline in response to an internal stress you can't see, but that is happening. This is not ordinary anxiety. This is the nervous system sounding an alarm. If this happens to you, and without explanation, without fever, without physical exertion, do not ignore it. The 6th sign is unexplained nausea and vomiting. This is one of the most dangerous, precisely because it seems so ordinary. You eat something different, your stomach feels off, and you immediately think it's a digestive issue. But there's a group of people who need to be especially careful here. Diabetics. People with diabetes can experience what we call a silent heart attack. No chest pain, no classic sign. The nausea may be the only warning. And if it comes alongside any other sign on this list, there is only one path: immediate medical attention. Have you ever woken up nauseous for no clear reason without having eaten anything unusual? Well, leave that in the comments. The 5th sign is strong dizziness and sudden weakness. Not the lightheadedness from getting up too fast. I'm talking about the feeling that the room is spinning, legs that seem unable to support your own weight, a weakness that hits suddenly and doesn't pass. This sign is especially common in women, and it's one of the reasons why female heart attacks are so frequently underdiagnosed. The woman feels dizzy, weak, a vague sense of being unwell, and both she and those around her attribute it to stress, blood pressure, or the exhaustion of the day. Meanwhile, the heart is sending a signal. The 4th sign, I need you to pay special attention here because this is the decision point. This is the sign that if it appears, you can no longer wait to see if it passes. Heaviness in the left arm, numbness in the pinky finger, a strange sensation on the inner part of the hand as if the arm has fallen asleep, but different. There is a nerve pathway that connects the heart to the upper limbs. When the heart muscle begins to suffer from lack of blood flow, that pathway fires. The left arm is the first to receive that signal. It's not a coincidence. It's anatomy. And when this sign appears, especially alongside any other on this list, The path leads to the emergency room. Not tomorrow, now. So you already know 4 signs, and you may be thinking, but I've felt some of these things before and it turned out to be nothing. That's possible. The body has many ways of communicating minor imbalances, but the key is not in one isolated sign. It's in the combination. It's in the persistence. It's in the context. When 2 or 3 of these signs appear together without a clear explanation, the risk rises significantly. And the next 3 I'm going to show you are the ones that most frequently precede the critical moment. The 3rd sign is shortness of breath at rest, not the breathlessness of someone who just climbed stairs or ran. I'm talking about waking up without air, feeling like you can't breathe properly while you're lying down still, not doing anything at all. Sometimes a person gets up to make the bed and has to sit down to catch their breath. It sounds like an exaggeration. It isn't. What's happening inside is serious. When the heart begins to lose its pumping capacity, it can no longer circulate blood efficiently. That fluid starts to accumulate in the lungs. And the lungs, with that buildup, can't expand properly. The result is that feeling of mild suffocation, which gets worse when you lie down and improves slightly when you sit up. If this has been happening to you for a few days, especially if it came with swelling in the ankles or legs, don't wait any longer. The second sign is one I consider among the most underestimated of all. Anxiety and undefined fear of feeling that something bad is going to happen, but you can't name what. There's no obvious reason. No negative thoughts on a loop. It's a discomfort that comes from deep within, almost instinctive. And there's a biological reason for this. The body perceives danger before the conscious mind does. When the heart starts operating under critical conditions, the autonomic nervous system goes into a state of maximum alert. It releases stress hormones. It prepares the body to react to a threat. And that preparation reaches you as anxiety, as restlessness, as a feeling that time is moving too fast and you need to do something, but you don't know what. Many people take an anti-anxiety medication. They lie down. They try to breathe deeply, and they lose precious time. Have you ever had that feeling without being able to explain where it came from? It's more common than it seems, and it's worth paying attention to. Now, the first sign, the most serious one, the one that leaves no more room for doubt, the crushing chest pain, not a stabbing sensation, not a twinge that passes in seconds. It's a constant pressure, as if someone placed an enormous weight on your chest and wasn't going to remove it. This pain can radiate to the left arm, to the neck, to the jaw, to the back. It lasts more than 5 minutes, and it does not improve when you lie down. Sometimes it gets worse. And here I need to talk about 2 mistakes people make at this moment, mistakes that cost lives. The first mistake is trying to relieve it with tea, baking soda, or sparkling water, assuming it's a gas or digestion problem. The pressure in the chest can resemble that bloated feeling. But wasting time on that while the heart is calling for help is fatal. Every minute that passes without care, more heart tissue dies with no possibility of regeneration. The second mistake is getting in the car and trying to drive yourself to the hospital. If you are experiencing intense chest pain, you should not be behind a wheel. Call emergency services. Ask someone for help, but do not drive. The heart muscle does not get a second chance. What dies, dies. And that is precisely why the golden hour exists as a consolidated clinical concept. Arriving at the hospital within the first hour after symptoms begin allows doctors to unblock the artery and preserve most of the muscle. Waiting 2 or 3 hours can mean a lifetime with a compromised heart. So you now know all 7 signs. And now comes the part that matters most, what to do with this knowledge. Recognizing the sign is the first step, but acting fast is what saves lives. And acting fast starts before the emergency. It starts in the choices you make today, tomorrow, next week, because a heart attack doesn't appear out of nowhere. It's built over time in silence inside the arteries until the day the margin runs out. The good news is that this process can be slowed down, in many cases partially reversed, and the changes that make a real difference are not complicated. They are consistent. The first one has everything to do with what you put on your plate. I'm not going to ask you to follow a restrictive diet or count calories. I'm going to ask you one simple thing: unwrap less and peel more. Trade the processed foods for fruits, vegetables, foods that still look like food. The heart doesn't need perfection. It needs consistency. One better choice per day already changes the trajectory over months. The second change is quitting smoking. If you smoke, this is the number you need to hear. Quitting cuts your heart attack risk in half, not in decades, in months. The body begins to recover quickly once exposure to nicotine and carbon monoxide stops. The arteries begin to relax. Blood pressure tends to drop. Blood flows better. There is no habit change with a faster and more documented return than this one. The third is sleep. 7 to 8 hours per night is not a luxury. It's cardiac maintenance. During sleep, blood pressure drops, the heart rests, the body repairs tissue and regulates hormones. People who sleep poorly on a chronic basis carry a significantly higher cardiovascular risk. If you wake up tired frequently, if you snore heavily, if you wake up in the middle of the night and can't fall back asleep, that deserves medical attention. It's not trivial. It's a signal. The fourth change is movement. 30 minutes of walking per day. No gym required. No intensity required. Consistency required. Walking strengthens the heart muscle, improves circulation, helps control weight, blood pressure, and cholesterol. It is one of the most studied and most effective interventions for cardiovascular health. And the body responds, sometimes surprisingly fast. And the fifth, which many people overlook, taking prescribed medications without improvising. If you have high blood pressure or elevated cholesterol and you're in treatment, that treatment only works if it's followed every single day. Not just when you remember, not just when you feel something, every day. High blood pressure and high cholesterol are silent killers precisely because they don't hurt. You don't feel them while they're damaging your arteries. You only feel it when the damage has already been done. Now, one last thing before we close. If you feel 2 or more of the signs I showed you today at the same time, don't wait to see if it passes. Don't make tea. Don't lie down hoping it gets better. Call emergency services. Tell them what you're feeling. Let someone take you. The heart does not negotiate deadlines, and you don't need to reach the limit before seeking help. Your body speaks. You just need to learn to listen. Which of these signs did you never imagine could be connected to the heart? Leave that in the comments. And if you have someone close to you with a cardiac history or over 50, share this video right now. It might be the information that makes a difference at the right moment. If this content was useful to you, hit the like button, subscribe to the channel, and turn on the bell. There's a lot more to come.